most famous physical therapist on the internet.
Hi, folks. I'm Bob Schroep, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapists on the internet.
In our opinion, of course,
Today
Bob.
we have a new treatment for weak arm after stroke. This is especially good for like shoulder subluxation and more.
Which is pretty common after a stroke.
This is one of the cool things about having this channel, Brad. We get kind of exposed to some of the new equipment that's coming out there. And we think if it's worthwhile, we pass it on to you. We have no financial bearing on this. I mean, we get no remuneration, but you know, we think it might help some of the people that have had a stroke.
Exactly.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, you want to join us on our social media channels because we're always giving something away. What are we giving away right now? We don't know. Because this is a future video.
But it's going to be good.
It's going to be really good. So go to bobandbrad.com, go to the giveaway section, and let us know what it is.
Or Facebook.
Or go to Facebook and Bob and Brad on Facebook. And if you want a short version of us, a shorter version of our videos, go to Twitter and go to Instagram.
There you go.
All right. So we've been sent this device. It's called the Sabo Stim 1. We've had products from Sabo before. Really high quality organization.
Right.
They do a good job. In fact, I got another one coming from them.
Oh, good.
For the hand. But after stroke, many patients have a paralysis of the shoulder muscles. And basically what happens after a while.
Oh, we're going to show them on Sam.
Yeah.
Good idea.
The shoulder actually starts to come out of joint a little bit, just slightly. So you got the ball and you got the socket. It actually inferior drops a little bit.
Yep.
And you can actually feel a little gap there.
Right. You'll feel on one side, it's like here. It's tight here. You can get your whole finger in there. Of course, there's skin there, but it's very clear. You can oftentimes see it.
Yeah, you can see it. It's called the sulcus sign.
Sure.
And like, Brad, if I were to do it on you, do you mind just rolling up your sleeve once?
Okay. I'll do it for you, Bob. See if we got a sulcus sign there.
So I can just actually pull down like this, and yeah, you can often see it actually go down, and you can see like a little groove in there.
Right.
So
it all depends on if they don't have a lot of tissue, soft tissue underneath the skin. It's a little more obvious, but we want to keep that muscles active so that doesn't happen because that creates pain.
Absolutely.
And it limits function once the muscles do regain strength.
Perfectly said, Brad. And it affects up to 81% of the stroke patients. So this isn't a minor problem. The other thing is that this system can actually be used almost anywhere on the arm for helping re-educate the muscles.
Yep. Keep that thing moving in the right direction.
So pretty simple to use. It comes with the main device here, and then it comes with little wings, they call them.
Oh yeah, well it looks like wings.
Yeah, they look like wings. They even flap like them, and it has a charger, so it charges up really easily. Actually, it just hooks right on here.
Yeah, I'm impressed with that. It just easily
and then plug it in.
Yep, goes right where it's supposed to, right into your USB port, we call that, right?
Or a computer, yeah. Boy,
I'm catching on to this
stuff. That's a computer
Bob.
term for you. So anyway, I'm going to snap it onto the wings, very easily to do. And then when the wings, you have to actually put on the pads on the wings. You're going to show that, Brad, just real
These are replacement pads. They stick to your skin, and if you have used TENS or anything like that, you know that after so many times you need to replace it. And these are all nicely packaged so that you can. You're probably going to be hard to see this, but you can replace.
Yeah, you'll replace, and they tend
to. This is a nice system. I like this system.
Tends to run about 10 to 12 treatments. Uses the pads do.
Yep.
And you can extend them a little bit by putting a little water on them.
Right, just to clean them up.
Right.
It helps. Doesn't make them like new, but it gives you a little more time.
I'm going to have you hold this, Brad, just for the fact that we're on film right now. And well, you want to put it on this one?
Sure. Right.
So you're going to put it right across like that.
All right.
And we're getting the deltoid. And they found out, interestingly enough, Brad, is that the deltoid works more for pulling the humerus up into the socket than the supraspinatus.
Oh, well, that is interesting.
So they figure by stimulating the deltoid, you can do a better job. So I'm just pushing the center here and holding it for 3 seconds. And hopefully you can hear a little beep.
And
came
a
on.
little indicator light comes up.
Later. And now I'm going to go ahead. If you push on top, if you push on, oh, there we go. If we push on top, that turns it up. Ooh, I can feel it. Ooh, can you see it?
Give it here. Let me hold it, Bob.
Yeah.
I'll give you some. So yeah, I mean,
So it goes on for you.
ooh, there we go.
Okay, we're right
We
now.
definitely got the muscles to fire there. You can see us now. It's going on and off. How often?
8 seconds on, 8 seconds off.
Okay.
The thing is, when you charge this, it actually runs for 20. It'll last for 24 hours of treatment.
Oh, okay.
But this machine, this little unit, runs for an hour and then it pops off.
Okay.
So, and asked, what's the recommendation for how often you would use this,
hmm
and they would say, usually once or twice a day.
Okay.
So
A full hour each
yeah,
time.
full hour each time.
Yeah, you can
And,
really see those
yeah.
deltoids working there.
Now, we don't like to recommend anything unless there's some research behind it. And boy, the research really supports this. I was
Okay.
really surprised, Brad. I found everything was positive about,
Sure.
supporting it, saying
Yeah.
that it works well to decrease the incidence of subluxation and also increases function.
Sure.
Now, it didn't say as much about pain, but if you reduce subluxation, you're going to reduce pain.
Yeah.
In my mind.
It certainly,
Yeah, they
fits
go
together.
right. So now let's say you want to go ahead. I'm going to let it go one more time just to give you one more shot of it. Boy, that really does fire. So I'm going to turn it off.
We have to hold it.
Yep, I'm going to hold it for 3 seconds, and you hear beep beep.
Yep.
So now, Brad, you mind just pulling it off and putting it on my bicep?
Oh yeah. We're gonna do it carefully. We don't want to. We want to grab the pad so you don't.
Now, what's
irritate
nice
the
about the
connection.
wings actually flip a little bit, so you can turn them like that. See?
Change the
Yeah,
distance and the location.
yeah. So, like if the bicep's not
Yeah.
that long, you can flip it a little bit that way, flip it a little bit that way, and then I go ahead and turn it
You're pretty
on.
much covering your whole bicep, Bob.
Yeah, I need to work on that
Just
a little
kidding.
bit.
No.
So I'm gonna hold it for 3 seconds. Beep, it comes on.
Well, this will be interesting to see it.
Yeah.
So it's firing his bicep. So you're not.
No, I'm
controlling-
not doing that. We'll see how it goes this next time here after 8 seconds. But
Now there are some precautions for people who should not use these.
absolutely, thank you for bringing that up, Brad. They're the normal precautions that you'd have with TENS or EMS.
Yeah.
Like if you have a pacemaker, right?
Then you're not going to use it for
If
sure.
you're pregnant, you wouldn't put it over the area of pregnancy.
And there's a list of those. So
Yeah,
that you need
carotid
to look
arteries. Yeah, I'm sure they probably have it on their website too.
Yep.
So this is a way of trying to regain some function in the arm.
Mm-hmm.
So it's really quite clever. So this device, they have an introduction price of $99. They do want a prescription from your doctor though too,
Sure.
which I don't think would be hard to get. I mean,
Right.
so.
Right. What?
Well, it's just kind of wild how it just does its own thing. It's like some of the people I know in my life. So anyway,
Where are you going with that, Bob?
I don't know.
This deserves a why, Bob.
Why, yeah.
Let's carry on.
So you can put it, here. You can put it on your tricep. You can put it on to get your wrist.
Sure.
You can actually, they even showed it that you could put down below here to help with foot drop.
Right, which is a very common side effect of a CVA or stroke.
Right. So
get that anterior tib working.
So we'll have a link below. Take a look at it, and thank you to Sabo Stim for sending us the product.
You bet.
So take care.